The Minitab Healthcare module makes it easy to analyze and improve various key performance indicators in the healthcare industry. In this video, we will be focusing specifically on the cost section of the healthcare module. We will analyze data that consists of treatment costs for a specific type of infection. Our data consists of the cost of the treatment, the age of the patient, if one of two comparable drugs was administered, whether the patient was admitted to the intensive care unit, and which of two hospitals the patient was at. Given this scenario, we will open the Minitab Healthcare module and navigate to the Cost section and select the Treatment Costs option. To get a better understanding of our current treatment costs, let's first use visualizations. Selecting the Visualize Treatment Costs option will display the options available to do this. Visualizations can help us to better understand the distribution of treatment costs. A histogram is the type of graph we will use for this, and we will create it by selecting the Visualize the Distribution of Treatment Costs option. We will then make sure to populate our treatment cost variable into the dialog box and select OK. The graph then returns for us. This histogram helps us see insights into our treatment costs. We can see that most patients are treated for less than $5,000. We can also see from the histogram that the data are right skewed and that there are some large values for treatment costs on the right-hand side. Now that we have more knowledge about the distribution of our data, let's explore what variables have relationships with treatment costs. Predictive Analytics in Minitab allows us to explore at one time the relationship of many variables with treatment costs. To run Predictive Analytics, we will select the Predict Treatment Costs option. We will select the Use Complex Relationships with Multiple Predictors to Predict Treatment Costs option. This will allow us to fit a CART regression model. CART regression will help to identify the complex relationships our predictors may have with treatment costs. Before running that analysis, I can select the small information icon for more information and context surrounding CART regression from the online Minitab support menu. Our response variable will be treatment cost. We will have one continuous predictor, which is age, and then we will have three categorical predictors, and those are the drug administered, whether the patient was admitted to the intensive care unit or not, and what hospital the patient was at. To run this CART regression model, we then select OK. Our relative variable importance chart as a part of our CART regression output helps us to identify our most important predictors. Relative variable importance values range from 0 to 100%, with the most important variable always being 100%. In this example, the most important predictor of treatment cost is the drug administered. That is followed by whether or not the patient was admitted into the intensive care unit in terms of variable importance. To view how this CART regression model works, we look at the CART tree. The regression tree splits the data into high treatment costs and low treatment costs based on conditions obtained from the predictors in the model. The overall treatment cost was $3,475.03. If we look to the right, we can see that the mean treatment cost of those that received drug B was $5,375.67. We can also see the combinations of predictors that led to the highest treatment cost. We see that the group with the highest mean treatment cost is those that were administered drug B and also those that were admitted to the intensive care unit. And that mean treatment cost was $7,655.23. Since we know some of the important variables driving treatment cost, we can investigate our processes and make changes to reduce treatment costs. Let's assume that we have now implemented process changes surrounding a few of our important variables. We can then use the Minitab Healthcare module to demonstrate and verify that our process changes have reduced our treatment costs. To do this, we select the Decrease Treatment Costs option, and then we select Demonstrate that average treatment costs decrease after a process improvement. Here, we'll enter the column of treatment costs before the process improvement, and then the column of treatment costs observed after the process improvement, and we'll select OK. Because the p-value here is less than 0.05, we can conclude that we have successfully reduced our treatment costs. Thanks for your attention. Hopefully this video gives you a better understanding of how the Minitab Healthcare module can help you to manage and improve key performance indicators like costs.